You may have experienced a time in which you were struggling to stay awake, whether it was during a long, extensive lecture or during a movie. People that have narcolepsy do not have this ability to regulate sleep-wake cycles like most people do. In this video, you will discover the signs and symptoms, how the neuroanatomy of the brain is affected, how narcolepsy develops, and the limited but possible treatment options.
Signs and symptoms. Narcolepsy is a chronic neurological disorder that affects a person's sleep-wake cycles. It's categorized by having excessive daytime sleepiness, cataplexy, which is the sudden loss of muscle tone that causes the individual to become unable to move. Cataplexy is usually brought on by sudden emotional situations that can cause the individual to collapse, but it usually just attacks a certain muscle group, usually in the face, neck, hands, or knees. It also includes hypnagogic hallucinations, which are vivid hallucinations that occur right before falling asleep that seem very lifelike, that are similar to REM dreams. There is also sleep paralysis and sleep disruption during the night. There are also sleep attacks, which are sudden senses of sleepiness that come on very quickly. Some people with narcolepsy experience many of these a day, or some just very few. It depends on a person-to-person basis. There are also mental challenges, like a fog-like mental state associated with excessive daytime sleepiness. There's also difficulty with attention and memory. So narcolepsy is actually misdiagnosed a lot of times for things like depression, substance abuse, infections like encephalitis, or sleep deprivation. It's because there are a lot of common symptoms between these things, so it's really hard to really exactly identify that it's narcolepsy or something else. And then some of the diagnostic tests that are done to find if you actually have narcolepsy is called the PSG, which is a polysomnograph, which electronically records the physical actions of the body to see like what's going on, how deep they're going into sleep, and an MSLT, which is a multiple sleep latency test. It measures how long it takes to fall asleep during the day. So a shorter time can indicate narcolepsy if they fall asleep really quickly. So yeah.
The neurobiology of narcolepsy and the basis within the brain is caused by a loss of neurons, which produce orexins. These orexins are small neuropeptides in the lateral hypothalamus that have excitatory effects on postsynaptic neurons. If we recall back from a few chapters ago, it is important to remember about how these excitatory effects happen. This refers to the sodium-potassium pump and the threshold of excitation that forces that of the temporal summations that force a excitatory effect to happen, pushing sodium into the cell and potassium rapidly out, which cause these effects. These orexins have that same type of effect within the brain and cause these effects on postsynaptic neurons. The main function of orexins are to stabilize wakefulness and directing REM sleep, which, as seen in the last slide, are signs and symptoms, because the lack of this is that REM sleep is able to occur at any time of the day, which can be especially detrimental to the well-being and livelihoods of people who have jobs and lives they want to live, but may be struggling to engage with those lives on a greater manner because of the loss of orexins within the brain. Orexins are also related to the NARP protein, which is crucial for excitatory synaptogenesis, which basically keeps the neuronal network intact. That basically is in charge of making sure all the synapses are intact, doing any sort of house cleaning in the brain, and making sure everything is running smoothly. It is also related to the GABA receptor, which helps to control neurons when they are overexcited during times of fear or anxiety, which often occur during times of fight or flight responses, which cause huge excitatory effects on postsynaptic neurons. Now, orexins in the brain, if you look at the picture on the slide, have wide-ranging effects and are seen going throughout the brain. As you can see, it is located in the lateral hypothalamus, which is ventral to the thalamus in the brain, and rostral to the cerebral peduncle in the brain. And this then allows it to move through the frontal cortex, having effects in the frontal cortex, moving down through the cerebral peduncle, through the pons, through the medulla, and eventually through the spinal cord, to basically create a cascading effect throughout the brain and throughout the spinal cord to other parts of the body. So while the hypothalamus and orexins are a small aspect of the brain, they have wide-ranging effects and long-lasting effects on these people who lack them because they are unable to have that wakefulness and REM sleep that is very crucial to humans and the way we operate in life.
Narcolepsy affects both males and females equally. Symptoms often start in childhood, adolescence, or young adulthood ages 7 to 25, but it can occur at any time in life. It is estimated that anywhere between 135,000 to 200,000 people in the United States have narcolepsy. However, since this condition often goes undiagnosed, the number may be higher. Some people with narcolepsy are often misdiagnosed with other conditions, such as a psychiatric disorder or emotional problems, and it can take years for someone to get the proper diagnosis. Narcolepsy may have several causes. Nearly all people with narcolepsy who have cataplexy have extremely low levels of the naturally occurring chemical hypocretin, which promotes wakefulness and regulates REM sleep. Hypocretin levels are usually normal in people who have narcolepsy without cataplexy. Although the cause of narcolepsy is not completely understood, current research suggests that narcolepsy may be the result of a combination of factors working together to cause a lack of hypocretin. These factors include autoimmune disorders, family history, and also brain injuries. When cataplexy is present, the cause is most often the loss of brain cells that produce hypocretin. Although the reason for this cell loss is unknown, it appears to be linked to abnormalities in the immune system. Autoimmune disorders occur when the body's immune system turns against itself and attacks healthy cells or tissue. Researchers believe that in individuals with narcolepsy, the body's immune system selectively attacks the hypocretin-containing brain cells because of a combination of genetic and environmental factors. Most cases of narcolepsy are sporadic, meaning the disorder occurs in individuals with no known family history. However, clusters in families sometimes occur. Up to 10% of individuals diagnosed with narcolepsy with cataplexy report having a close relative with similar symptoms. Scientists are getting closer to finding genes linked to the disorder. These genes control the production of chemicals in your brain that may signal sleep and awake cycles. Rarely, but possible, narcolepsy results from traumatic injury to parts of the brain that regulate wakefulness and REM sleep, or from tumors and other diseases in the same regions of your brain.
Like mentioned in the development of narcolepsy, there is currently no known cause or cure for it. The treatment options available aim to improve wakefulness and reduce cataplexy attacks, hallucinations, sleep paralysis, disturbed nighttime sleep, and EDS, which is excessive daytime sleepiness. Medications that have been recently approved are pitolisant and solriamfetol. Pitolisant was approved in 2019 by the FDA to treat EDS in adult patients with narcolepsy. It helps change the amounts of certain natural substances in the area of the brain that controls sleep and wakefulness. It works by activating histamine released in the brain, which enhances alertness and wakefulness. Solriamfetol was also approved in 2019 by the FDA to treat EDS due to narcolepsy or sleep apnea. It is a dopamine and norepinephrine reuptake inhibitor that improves wakefulness and alertness in patients with excessive daytime sleepiness associated with narcolepsy. Other than medications, there are also behavioral techniques that people with narcolepsy can practice. These techniques include Number one being patients educating themselves about narcolepsy to better understand the symptoms, the developmental and nature of the symptoms, the impact of narcolepsy in personal life, and available treatments. The second one being establishing good sleeping habits is really important to successfully manage the symptoms. Napping from 15 to 20 minutes, about 2 to 3 times per day, are effective in treating EDS and improving alertness. They should not exceed more than 30 minutes, since longer naps can increase drowsiness. Self-reporting sleeping diary can also be beneficial. It can organize patients by containing information of the sleep habits, such as number of hours they slept, how long it took them to fall asleep, times they woke up and went to sleep, and the duration of nocturnal wakings. Finally, patients should be evaluated for psychosocial impacts on one's overall quality of life. There are also psychosocial consequences that can impact interpersonal relationships or financial stressors. Once evaluated, it can help determine what treatments would be best as well as what legal rights they have at work.
The following is a list of compiled resources we used to create this informational presentation about narcolepsy. This class has allowed us to dive deep into our brains on a cell-by-cell level. Utilizing that knowledge with what you have learned in our video, we hope you begin to understand more about narcolepsy. If you are seeking more knowledge, there is a website online called narcolepsynetwork.org where you can find more information. They provide quick links as to how to find support groups, doctors, or even donate to research. We thank you for your time and hope you enjoyed our presentation.